Hello guys, welcome back to my YouTube channel Knowledge is Power. Today I am here with you all to discuss about the neonatal jaundice. Basically I will discuss the difference between physiological jaundice and pathological jaundice. So without wasting much time, let us start with the topic. The physiological jaundice it appears after 24 hours after the birth of the baby. The total bilirubin rises by less than 5 mg per dl per day and the maximum intensity during the 4th and 5th day in term baby and 7th day in preterm baby. The serum level will be less than 15 mg per dl and it is not clinically detectable after 14 days. Coming for the pathological jaundice, it appears within 24 hours of age. The level of bilirubin it will be greater than 5 mg per dl per day. The serum bilirubin will also be greater than 15 mg per dl and the jaundice will further persist after 14 days. The stool color will be clay, white colored and urine staining, yellow staining clothes. Now let us know about the characteristics of physiological jaundice. Already I have mentioned that it appears after 24 hours. The total bilirubin rises. It can be less than 5 mg per dl and it will increase per day and the maximum intensity will be during 4th and 5th day in case of term and 7th day in preterm baby. The serum level will be less than 15 mg per dl and it is not detectable after 14 days. And do you know why does physiological jaundice develop? So there are certain risk factors. If the baby is having increased bilirubin load or the baby is having defective conjugation, if the baby is having increased enterohepatic circulation, in such cases a baby may develop physiological jaundice. And mostly it occurs in 60% of term baby and 80% in preterm babies. Now let us discuss between the difference between physiological jaundice and pathological jaundice in a brief way and in a easy way. So the onset of physiological jaundice will be after 36 hours, that is second and third day. The onset of pathological jaundice will be at any time even after 1 hour of the birth of the baby. Then the rate of bilirubin. So the in physiological jaundice the bilirubin level will be less than 5 mg per dl per 24 hour. In case of pathological jaundice, the bilirubin level will rise up to 5 mg per dl per 24 hours. Coming for the peak level of the bilirubin concentration, up to 14 mg per dl in preterm newborn in case of physiological jaundice, and in case of pathological jaundice, it will be 14 mg per dl in preterm newborn. Then the duration of persistent in case of physiological jaundice, 8 days. In case of 8 days it will last if the baby is under fluorescent tubes, or in case of pathological jaundice it will be greater than 1 week, so it can last more than 1 week. Then 14 days in preterm newborn in case of physiological jaundice, and in case of pathological jaundice it can last more than 14 days. Coming for the serum level, so the physiological jaundice there will be it will be less than 2 mg per dl at any time, and in case of pathological jaundice the serum bilirubin level will be greater than 2 milligram per deciliter. Now coming for another factor, that is the clinical presentation. So in case of physiological jaundice the baby will look normal, he or she will not look anemic, not sick, normal color urine will pass by the baby and normal stool color will be passed by the baby. But in case of pathological jaundice, the baby will look abnormal, anemic, sick, and abnormal color of urine and stool. Generally, clay color stool will be seen in case of pathological jaundice. Now let us discuss about the pathological jaundice in a very brief way. So already I have mentioned in the differences that pathological jaundice it will appear within 24 hours of age. The bilirubin level will increase and it will be greater than 5 mg per dl per day. Then the serum bilirubin will also get increased greater than 15 mg per dl. And the jaundice will persist after 14 days also. And the stool color already I have mentioned, it will be white color or stool will be clay color and urine will be stained with yellow color. And at last the direct bilirubin will be greater than 2 mg per dl. Now, coming for the different types of pathological jaundice, there are two types: unconjugated bilirubin and conjugated bilirubin. The unconjugated bilirubin, it will be due to hemolytic causes or sometimes due to non-hemolytic causes. In case of conjugated bilirubin, that is due to some disease conditions, and it is also known as pathological conditions. Like if a person or if the mother is having hepatic diseases, and if the mother is having past history of hepatic diseases, then also her baby may suffer from jaundice. Other factors involved in causing pathological jaundice is that due to the Rh incompatibility, it may lead to erythroblastosis fetalis. Then, if the mother is having ABO incompatibility, blood grouping reactions due to some viral infections, or sometime due to toxoplasmosis or torch-like infections or sepsis, may lead to cause conjugated hyperbilirubinemia. Other causes includes inborn errors of metabolism like tyrosinemia, galactosemia, and post-hepatic causes like biliary atresia, and sometimes due to the deficiency of G6PD. All these factors may lead to cause pathological jaundice in newborn. Hope you all guys got brief idea regarding the differences between pathological jaundice and physiological jaundice in newborns. In my coming lecture, I will be discussing thoroughly about the neonatal jaundice, also the assessment, then coming for the treatment. Thank you guys for watching this video, and if you find this video useful, please share among your friends. Please don't forget to give your valuable feedback in the comment section below and suggest some topics you want to discuss along with me.